muscle mass is the number one indicator of longevity, of long, healthy life.
So lifting weights, increasing muscle mass is kind of one of the modern day fountains of youth.
It's a non-negotiable. You have to do it.
Welcome to the Bucket List Life Podcast with Trav Bell, the world's #1 bucket list expert. Bucket List Life's mission is to help you get off the treadmill, stop Groundhog Days, hack your habits, and live a regret-free life. Because we know life's way too short not to live your bucket list life. So please welcome your host, Trav Bell, the Bucket List Guy.
Hey Bucket Listers, welcome to another episode of the Bucket List Life Podcast. I'm your host, Trav Bell, the Bucket List Guy, and today we have Joya Van Der Laan. Hopefully I've said that right, Joya.
Very close, Van Der Laan, but we get all sorts of pronunciations, so there are no worries.
I'll blame it on the Australian accent, Van Der Laan, you know. So, hey, look, I've brought you on for two reasons. One, to demystify a few, let's say, medical debates. And two, for me, because I've just turned 50. I've had a half-life crisis, I guess you could call it. And the word longevity really wasn't in my vocab when I was south of 50. So now it seems to be every second word that I'm saying at the moment, longevity, longevity, longevity. So I wanted to get you on because, one, you know, for those reasons, but also if we want to live our bucket list and tick more stuff off our bucket list, we got to be healthy, you know, and there's so much freaking information out there. It is confusing. Everyone's got an opinion. There's so many influencers out there speaking shit, and it's so much right information. You know, we suffer from infobesity, right?
Oh, that's a good term. I love that.
Yeah, write that down. I stole it from someone else.
Yeah.
I can't quote infobesity. I want to know, like, if you're coming to Australia, you have to fill out an incoming passenger card, and on that, it's like you got a little space called occupation. And you've got to fill in your occupation. So if you're going to fill that in right now, you're coming to Australia, we're going to hang out, and you've got that little space to fill in. What are you filling it in with? What do you call yourself in that little occupation area?
Yeah, so professionally, I'm a nurse practitioner and a family nurse practitioner.
A family nurse practitioner. Very cool. And so how long have you been doing that for?
So I've been doing this since 2011 and then have been a nurse before that, before I got the extra training, since 2004. So it feels like just the blink of an eye, but it's been kind of a long time. And then since 2018, I opened my own practice and really focused in on the functional medicine, functional integrative, and now longevity is the buzzword, or health span, right? So.
And that's what I wanted to really dive straight into. Like, your business is called Nourish House Calls. How did you arrive at Nourish House Calls? Because, is this a food delivery service? Is it, are we counting macros here? Why Nourish House Calls?
Yeah, so nourish, there's so many things that we can do that are nourishing to our body, mind, soul, spirit, kind of all of us, right? Body is just one part of what it takes to be healthy. We need to pay attention to the body, but also these other things. And I wanted to focus on things that are nourishing, not only food. Of course, food is a focus, but certainly not the only focus. And the house calls piece, one unique thing about my practice is that I will do house calls, kind of like old-timey medicine how it was when it was still considered to be great or better, right? In a lot of ways. Individualized medicine, time with the patient, listening to the patient, really knowing the patient so I can understand them, their goals, what they need, what education they would benefit from, and provide all that in their home or in their office. So
with a 14-hour, whereabouts in the world are you right now? What part of America are you in?
We are in Chicago,
Illinois. That's even longer. So it's probably another 4 or 5 hours to LA. So you've got another 14 hours to Melbourne in Australia. So a house call. Can we organize? You know where I'm going with that. It's so house call might not be, an Australian house call might not be on the cards right now, but hey, this does go global, people, so you never know.
Exactly.
So what's the difference between conventional medicine and functional medicine? Because you're all about functional medicine. So I really want you to dive into what is functional medicine, because we're hearing a lot about that now versus conventional medicine.
Right. So I have the kind of traditional, modern or conventional training as a nurse practitioner. And so that benefits me in a lot of ways. That is really good to know when I'm treating patients. However, and there are a lot of differences. And so I'll touch on kind of the highlights. To me, functional medicine really aims to look at root causes of illness, of symptoms, and solve those roots. So if you think of our body, our health like a tree, sure, you could treat the leaves, right? And say, oh, there's, fungus growing on the leaves, or the leaves are yellowing. Let's treat the leaves. Okay, well, that's not a great solution for curing the problem. The problem probably starts from the roots or from the soil. And so if you can get to the root causes of a lot of these problems, now instead of needing to constantly treat or use Band-Aid solutions, as we like to say often, that you're going to be on for the rest of your life, let's treat the soil that those roots are in. So your environment, let's treat the roots. So is there, gut bacteria that's imbalanced? Is there inflammation happening? What is going on at the root? And maybe it's something physical, maybe it's something emotional, maybe it's a combination. It's usually a combination. There's not usually one root cause of somebody's issues. And as you might imagine, that takes a lot more time to kind of investigate and figure out and sleuth to figure out what are those root causes, and then how do we help the patient solve those for good so their body then can do what it's supposed to do and heal so that they can be healthy in an ongoing way and not need to be on a pharmaceutical, for example, for the rest of their life.
Yeah, I mean, there's a place for, putting the Band-Aid on, so to speak, and I mean, we'll dig into that in a second. Big Pharma, oh my God, hasn't that just saying the word Big Pharma, the words Big Pharma after COVID.
You just got to take a deep breath there.
Yes. Yeah. But that is a great example, using the tree analogy, that we're all, I guess traditional, conventional medicine is about treating the leaves.
That's more the focus, because it's kind of more immediate solutions, right? And to be fair, our society, and American society for sure, I would imagine Australian society as well, is very instant gratification driven. And so that antibiotic that seems to make your ear infection go away in 3 days, although it probably would have gone away in 3 days anyway, is very appealing. So appealing immediately, but then can have, long-term consequences. So, and that's just one example. But, blood pressure medication, cholesterol medication, antidepressants, like nobody's asking in conventional medicine, why are these things happening? Why are they happening at higher rates? Why are cancers happening at higher rates? All right. So, modern medicine, it's great. It's wonderful. Okay, we can save lives. We can improve the length of somebody's life, although that's even starting to not be true anymore. But what is the quality of that person's life, especially near the end? I think that's a really hard thing to think about when you're that person or when it's your family, but it's a really important thing to think about what the quality of those years, and especially those last years, are.
My parents would probably turn around at this point in time and say, well, good on you, tree hugger, you hippie. That's all well and good, but I trust my doctor, and he fixes me every time he or she fixes me every time I go in. So what's the problem? So educate those people about what the role of functional medicine is, treating and I'm going to use the analogy again, using going to the root cause of the tree. Have people woken up since COVID? the pandemic? Have a lot of people been questioning conventional medicine since? Have you seen a rise in, decreasing conventional medicine, let's say, and increasing functional medicine since COVID? Are people, second guessing more? Or
I think there are kind of two camps, maybe even more than there were before. COVID, as we all know, I think has been very divisive. And so the people whose eyes were opened, I think now are really like, oh, maybe the government doesn't have our best interest in mind. Maybe there is some financial, questionableness with pharmaceutical companies and what the government decides that we need or don't need. So I think that, yes, there is. Now, you have to understand, I'm in this world too, right, of more functional medicine. So the patients who come to me certainly are those people who have had their eyes opened. And once your eyes are open to this and you start to know that you can ask these questions, it's like a waterfall or, a fire hose opening up. And then we start to make these jumps from, oh, well, what does that mean? And why would they do that? And once you start questioning that and maybe finding some answers on and understanding the motivations behind some of these decisions or, some of the events that have, transpired.
You're not going crazy on conspiracy theory here, and I could have easily got a conspiracy theorist. I mean, there's about 1 billion of them jumping, but is it conspiracy? Do they have our best interests? Are we being played? What are your, and please go there, what are you, from your background, and that's why I love having you on, like you've got one foot in both camps. You've done your training, traditional training, but you've chosen this path. And, there's a argument for both, of course, but it sounds like you're erring more on, well, don't trust what you see out there, just dig into that.
I think we have to go in with our eyes wide open and not trust blindly. I think it's hard to paint with such a broad brush that we say the government always or never does something. And that's kind of a lot of life in general, right? Is there's a lot more gray than our brains sometimes will allow us to initially recognize. And do I think that there were some really bad decisions made during COVID that absolutely did not have the population's best interest in mind? 100% yes. Do I think that everybody who was trying to make those decisions had bad intent all the time? No, I think there was some of that mixed in there, certainly. But I think, what I've learned, and I think what a lot of people have learned, is it's okay to question. Just because it's the CDC, just because it's Anthony Fauci and he holds this position, does not give him immunity from us being able to say, well, let me ask you, why are we doing that? We should understand why we're doing something, what the rationale is. It should never be just trust me because I'm the expert. That to me is a very dissatisfying and a very lazy answer to give, and kind of undermines the intelligence of the entire population then, if we're just saying, well, I'm the expert, trust me.
Yeah. And before that, we jokingly said, Dr. Google, because everyone would come into, and it happened before COVID, right? I know I was doing it because I've got a human movement degree, a bit of a background, been healthy my whole, I'm very interested. I don't take things blindly. Just because a guy or a girl has got a white coat on, so I've personally been questioning stuff for a long time. But I've taken stuff blindly as well in the past. I think we all have. So how is it shifting? Do you think that the population is eyes wide open more? Have we got a long way to go? Even with the stuff that you offer, and we'll get into in a second, are people questioning that?
Yeah, from my perspective, what I see is that people are starting to question more, open their eyes more, be more open to this, quote, alternative kind of realm of medicine, right? And I think also what happens is people want to find caregivers, whether that's doctor, nurse practitioner, whatever it is, that they can identify with.
And trust.
Right, and trust. And so I think that a lot of my patients, when they go to their regular doctors, they get met with a framework of thinking about this that they just do not agree with. And so that's very hard then to accept medical advice from somebody with whom you so wholeheartedly disagree on kind of now what's become core topics.
Yeah. Yeah.
And a lot of traditional, even in traditional medicine, conventional medicine, there has, again, been kind of this divisiveness where maybe this has caused some of the physicians, nurse practitioners, PAs to become more open-minded. But I think a lot of them have sort of clamped down on what they, were taught and what they know to be true. And we are not veering from this. And so that just is not sort of an open position where a discussion can be had with a patient. If patients often feel like they just cannot ask questions because they're going to get met with this judgment or
Hostility.
resistance, and definitely hostility. Yes.
Yeah, you put yourself in the shoes of a traditional, doctor, clinic doctor, and you can imagine their 6 minute, 7 minute, appointments are now 15-minute consult, 30-minute conversations. Like, they just want to probably say, shut up and take the pill like you used to. But
right.
We're not. Regen and longevity medicine. Talk to me about that. What is that?
So they kind of go hand in hand. If we're talking about regeneration, a regeneration of tissues that are degrading with every second that we're alive, right? If we can regenerate those tissues, that promotes longevity. So regenerative medicine includes things like PRP, stem cells, peptides. But regenerative medicine also has to include a lot of the basic things that many of us who kind of are in the field take for granted. But for example, eating a healthy diet is regenerative. Moving our bodies in healthy ways is regenerative. Sleep is very regenerative. Having good relationships, managing our stress, very regenerative. And so a lot of what I talk to my patients about is those basics. First of all, we have to have those basics in place before I give you a stem cell injection, before I give you peptides, or at least at the same time as we do these things. Because if we don't have those basics in place, the kind of more sophisticated and costly regenerative interventions, treatments are not going to work as well. Those regenerative treatments are not going to work as well in an inflamed body, in a body that has been drinking alcohol and eating sugar and processed foods, right? So, and this is why functional medicine is wonderful and takes time, because as you can see, there's a lot of teaching, a lot of guidance that needs to happen in order for the patients to be successful and get results. So that's regenerative medicine. Go ahead if you have a question.
Yeah, like I gave up alcohol. Not that I had a big alcohol problem or anything like that, although some of my close mates could argue that at times I certainly did on some nights out. But gave up alcohol at age 50, 50, just over 51, 51 now. So I guess we could talk about, some of the stuff on your website. You've already mentioned, we've got IV therapy, PRP, which is platelet-rich plasma, laser therapy, hormone therapy, stem cell, ozone, peptide therapy. This is all hieroglyphics to most people. We'll dig into it. But, sleeping better, eating right, moving, I always say lifting weights, 100%. Especially, there's no one prescription that a doctor can give you that lifting weights on the regular will actually, they're like that smashes everything. And I'm
not sure there's a prescription or a combination of prescriptions out there that would give you all the benefits of really good lifestyle changes, right? Weightlifting, yeah.
So we can add all the stuff that you do, but your baseline is like get somewhat healthy first.
Yes. And that means nutritionally, that means hormonally, right? So balancing, optimizing hormones, not only does it make you feel great now, partially because your body is working better at a cellular level, but also then helps to improve longevity and health span because it decreases risks for all sorts of different things. So
there's no big pharma money in that.
Well, not the way I do it. I compound because it's individual doses, right? I don't want to give you a patch that's the same for, patient A as for patient B. It's just our bodies aren't created that way.
So you do an assessment process. Take me through that. And then what I love is then you have these membership levels. But yeah, take me through the assessment process and treat me as a client.
Yeah. So the first thing would be I usually do a discovery call with patients and spend about 15 minutes just learning what they're looking for, making sure that I am the right person to help them. I'm a cash-based practice. I don't accept insurance. And so I want to make sure before the patient pays me anything that this is going to be a good fit, both for them and for me. I don't want to work with somebody who is not sort of, on board with this stuff, right? If they're looking for a traditional medical provider who's going to be doing the prescriptions, that's not me. So I don't want to waste their time or my time. And so it's kind of, a discovery call. From there, typically, probably 95% of patients I have discovery calls with are going to go on to book their initial appointment. I spend 90 minutes with them and we go over a very extensive health history questionnaire that I've sent to them and they've filled out ahead of time. So I can learn what is their history, what are the symptoms that they're having, what's going well, what's not going well, what are their diet patterns, what are their sleep patterns, what relationships do they have? Are they healthy relationships? What stressors are in their life? Is it financial stress, family stress, work stress? What stresses them out? I can learn a lot about these patients. And then, of course, traditional medical history, family history, surgical history, medications, allergies, all the kind of typical stuff.
Damn, it sounds like one of my life coaching. Half of that is, life coaching. Yeah. Discovery Call 101. That's pretty cool. That's very holistic. I like it.
Yeah, all of that stuff impacts our physical and our mental health.
Definitely.
So it's really important if we're going to take this all-encompassing approach to assess and evaluate and know the patient on all these levels. Not only do then I know that, but the patient knows that I care. They feel listened to, they feel heard, and that is very new for them with a medical provider. You can't do that in 7 minutes. I don't think the traditional medical providers are trying to do a bad job. I just think they're not set up for success.
Yeah, and there's pressure, we'll go over it again and again, I'm sure, but I just want to compare your world to what the traditional medical world is. When I come over to America quite a bit, and in between, the talks that I do over there, always in the hotel, get some comfort food. It's not that bad, but get some comfort food, watch some American TV. And the amount of drug advertising is you are bombarded. We're not allowed to do drug advertising over here.
I didn't think so.
And oh my God, it is so prevalent. It is so obvious that a big pharma, are they propping up every network over there or what?
So, and I don't have, of course, solid proof of this, but from what I've read, what is the statistic? It's something like 66% of mass media is paid for by big pharma or owned by big pharma, something like that. So there is a connection there. And so, of course, you're not going to hear on national news, ABC, NBC, whatever it is, be careful about those vaccines or, I don't know, do you really want to take that medication? Because that goes directly against the profitability and interests of their supporter, their financial backing.
I think it was on Joe Rogan podcast. There was someone interviewed recently. I forget who it was. God, it might have even been Dr. Phil or someone like that. And they were saying, and this is what highlighted it for me, or what got my attention, is that most of the networks over there are propped up by big pharma money and the advertising. And someone in big pharma, or that guest said, no, they actually advertise to just so there's no complaints. They advertise to shut everyone up. Everyone who watches that channel and the guests they have on the shows, they're just basically pay enough money so no one complains about what's actually going on. And, of course, they don't want to piss off the advertisers because it'll wreck the network. And so it's an insurance policy for them to keep pushing the drugs because no one can complain at that particular network. So
Joe
Very
Rogan's
interesting.
with Brigham Bueller probably 6 months to a year ago was very interesting and kind of connected a lot of the dots on a lot of those connections, unfortunately. Yeah.
Yeah. So look, we could go on and on about that, and I think the gate is wide open. We're all questioning. So you do your assessment. I'm 51. I've given up drinking. I eat pretty well, I think. Sleep pretty well. Exercise. Got diagnosed a bit of arthritis in the right knee. Got a bit of bursitis going on in this shoulder from surfing too much, and want to live. So, what are we doing? That's the diagnosis, and there's probably a few more categories to fill in there. But all right, what do we do now? You've got a smorgasbord, should I say, of different things that we could do, different therapies, if you like. How do you pick and choose?
Yeah. So, part of the assessment is kind of putting the puzzle pieces together and figuring out, whereas traditional medicine would go, oh, well, we'll treat the bursitis with steroids. We'll treat the arthritis with some, hyaluronic acid injections or maybe steroid injections there as well. We'll treat one thing at a time and kind of, throw darts at it. Okay.
I've got asthma. And I've grown up with eczema too. But
yeah. Okay.
I'm allergic to everything.
Yeah. So now part of what I'm starting to think is, is there a commonality between a lot of these symptoms? We know that inflammation and immune dysregulation play a big part, not only in aging, but certainly also in these kind of localized, a bursitis or an arthritis, asthma, eczema. So, and of course, like the aging, right? Too, like inflammaging is kind of a term that was coined, in some of the courses that I take.
Oh my God! Never say that word to me again. Now that's imprinted. Inflammaging. I don't like that word. I hate that word now.
Well, and inflammation causes oxidative stress. Inflammation causes immune dysfunction, causes irritation of the tissues. When the tissues are irritated, are the cells replicating properly? Once you start to understand on a deeper level how the body is working, how it was created, then we can start to go, oh, well, that bursitis and arthritis and likely the eczema, allergies, asthma all have an inflammation component, at least, right?
For sure.
And so, well, what are we doing that is promoting inflammation, and what can we do then to promote anti-inflammation? Okay, well, let's look at diet. Are you having enough protein and produce? Are kind of what I just tell people are the staples. Ideally organic, paleo, high quality meats, eggs, fish, and organic veggies when possible. We're never going to be perfect with that, but when we can make a better choice, we make a better choice, right? When you're out to eat, when you're, at somebody else's, when you don't have control over what you eat the best choice that you could make there. Sleep. How are you sleeping? Are you closing your eyes and you're saying you're sleeping? Are you getting high quality sleep, deep sleep, REM sleep? How long are you sleeping for? Are you waking refreshed? What is your stress level like? How are you breathing? Are you activating that parasympathetic nervous system and the vagus nerve, right? Are we breathing with our shoulders and stressing ourselves out more, causing inflammation, causing cortisol spikes, and then sugar spikes and insulin resistance, and now hormone dysregulation, right? Like it all kind of piles on. So looking at all these things and knowing where we can make the changes. Are we using toxic cleaning products in our house? What are we putting on our body? Is the anti-aging face cream that we're using applying toxins to our bodies every day? Even the expensive stuff is full of fragrances and parabens, which are not only toxic, but also hormone disruptors. I would look at hormones, right? Like as we age, females and males, we experience decreases in our sex hormones. For men, the one that we think of the most is testosterone, but there's also DHEA. And we want to then look at replacing that where it's appropriate and optimizing so that we are looking at the biochemistry, looking at a person's body and what's going on inside, what their symptoms are, and linking those things together, and then kind of looking at almost common denominators and figuring out where can we make the most impactful changes.
God damn.
I love this stuff.
Yeah, you can. I can kind of tell, and you've scared the shit out of me. So thank you. No, in a great way. I've got a vested interest in this, and so and I actually just want to just ask a personal question. PRP. So, what are we doing in PRP? Because that I'm one of my bucket list items. Okay, get ready for the laugh. But one of my bucket list items, actually on the bucket list board here. Oh, right here.
Love it.
Boom. And there's a bunch of guys there, all shaved down and painted orange, and are on a stage, and they're in barely nothing. If you're listening to this, I'm pointing at a bodybuilding competition, but they're all in kind of like, European man shorts kind of thing. So it's like a physique comp. And one of the bucket list items that I'm aiming to do this year is and it scares the shit out of me, it's an extreme sport, but to see in a kind of FU 50 milestone is to get up and get fit enough, get trim enough, buff enough, if you like, a long way to go, to get up on and have a crack at a physique comp.
Love it.
The bursitis, of which, yes, I've had a steroid injection thus far, and it won't go away. I've got to stop surfing. But I think it was the PRP that gets thrown around quite a bit in that bodybuilding world. Am I right in saying that?
Yes. So PRP is essentially the process is draw the patient's blood, spin it down in a very specialized tube so that the red blood cells are separated from the serum, the plasma. And then because of the specialized additives in the tubes, it separates in the exact proper way so that we can draw off that clear part, that platelet-rich plasma, PRP, and actually use that from your own body to inject into the area of concern, whether that's a joint or muscle tissue, a bursa, ligament area, like a muscle tendon sheath. And what that does is actually causes a little bit of inflammation. Now, we just talked about inflammation being a bad thing, right? But inflammation has a purpose in our body if it is a short-term acute inflammation that ends when the healing is completed. The problem with inflammation is that we just are constantly inflamed and it doesn't shut off. And now the consequences of inflammation are long-term. So the short-term inflammation actually brings a lot of healing factors to the site of injury. And so by injecting PRP into the site of injury or inflammation or tissue damage, the place that we want regenerated, it kind of calls the body's attention. It almost is like it sets a little fire in that area and calls the firefighters, the body's kind of healing system, the immune system, stem cells even, and calls the body's defenses to that area and says, you need to put out this fire now. Whereas a steroid actually can cause tissue damage, especially if you repeat the steroid injections over and over. So again, the steroid is a Band-Aid solution, acceptable in some situations, but it's definitely not regenerative.
Okay.
I know, I'm sorry.
Glad I got you on the podcast because I'm about this far away from. I knew there was a reason. I'm about this far away from getting another steroid injection, but I'm yeah.
Okay. Did they ever ask you why you got bursitis? How are you moving? How are your shoulder blades moving? How is the humerus moving? Like how is your upper arm?
No, I've got a deeper story about that. No, the doctor didn't. And he goes to the gym with me. He might even listen to this podcast, but I don't care. Because I said, there's something wrong, and it wasn't diagnosed. And I said, I'll need to go and get a scan, just to go and get it checked out, an ultrasound or a CAT scan or something like that. And, hang on, what's the other one? Not a CAT scan.
An MRI.
MRI. And he said, no, you don't need it. You don't need it. Take some painkillers and play on. And I said, really? I don't know. It's just, I know my body pretty well and it's just not going away. Anyway, I come back and it was severe bursitis. And he's like, oh, really? And I'm like, dude, you said not to worry about it. And here we are, like, look at my pictures of my shoulder. Like, dude, you lost respect.
This illustrates really good points. A, they're not trying to do a bad job. They're practicing what they know, right? He's not trying to hurt you. He's not trying to dupe you. He's not trying to do a bad job. He's practicing what he's been taught. And the other thing is, you said, I knew something was wrong with my body. I knew it, right? You knew it. You could tell. And we're often told then in those situations, well, just ignore it, and ignore your body's signals that it's sending you. And I tell patients all the time, we've got to tune back in. How do you feel after you eat something? How do you feel after you do a certain exercise?
Intuition is everything, right? Intuition, be more intuitive with our own bodies and our own health.
So, why is it that you were prone to develop bursitis? Your body should be able to do these things. Is there something moving in the mechanical system wrong? Are you compensating? Is a muscle too tight? And so then, the joint is not moving properly. Is the collarbone that comes through, the clavicle here, is there something impinging? What is going on? And maybe that's a physical therapist who evaluates that. But if you don't solve the root problem, we can put all the PRP and stem cells in there that we want, but we have to look at this holistically too and understand, is there a cause for this other than an acute injury, which, okay, well then don't, fall off your surfboard and land on a rock or whatever you did. But
I didn't. I have dislocated this shoulder 12 times and I can put it back in myself. So that might have a contributing factor. I don't know.
Sure. So that is a thing to think about. Yes.
Don't be a dickhead, Trav. I think that's the diagnosis. Less about me. Let's just really quickly, I just want to get clear on some of these terms, not just for me, but for, our listeners and watchers. Without going full nerd on it, with respect, IV therapy, what is that? People are connecting to bags all the time. There's people getting on IV drips, everywhere I look now, obviously, as part of cold therapy clinics and, putting on so these sort of, what do you call them? Regen clinics are popping up everywhere.
No, it seems they are, yes.
Yeah, IV therapy, go for it.
So normal supplements that we take orally at best are absorbed probably about 30 to 40%, assuming we have an optimally healthy gut, which most of us don't have unless we've, worked on that. IV therapy, 100% of the vitamins are infused directly into the bloodstream for use, for access to the cells, doesn't depend on our GI system. And I can also give a lot higher doses of things like vitamin C and magnesium without having side effects like diarrhea, for example, that you would get at those doses taken orally. So it's really a supercharging of, a supercharged way to take nutrients, vitamins for all sorts of different purposes. These nutrients are needed for so many reactions in the body. So it's really important that we have adequate levels.
Love it. Laser therapy.
Yeah. So I'll throw out a term there called photobiomodulation. And this is how laser therapy typically works. There's a component of red light therapy to laser therapy. There's lots of different lasers out there now. The particular one that I have is a class 4. So at that time anyways, the highest level laser you could get in the US, it's actually made in Italy, but drives light into the cells, kind of like sunlight.
Is this our red light therapy?
So this includes red light, but is kind of, again, a supercharged or a much higher level healing than that. Red light therapy is great and more accessible to people at home, certainly, than lasers are. But the laser kind of directly goes in there, changes the way we perceive the pain, builds new blood vessels, improves blood flow, is regenerative, so promotes healing in those tissues and cells. So it's really great for injuries, wounds, pain. Yeah.
Hormone therapy?
Whoa, love. So I really love treating patients with hormone imbalances, especially men and women kind of in their 40s, 50s, and beyond, because the treatment is so impactful when we optimize for women, things like estrogen, progesterone. So when I'm talking about estrogen, E2 and E3, so the estradiol and estriol, progesterone, DHEA, but also looking at cortisol. And for men, looking at cortisol as well, but testosterone and DHEA. And are they converting the testosterone well? Are the women converting estrogen well in a healthy way, beneficial way? Looking at melatonin as part of that hormone picture. Women going through menopause are undertreated for sure, and there's so many myths about the cancer risk that are just simply not true, even for men with testosterone. the myth about testosterone feeding the fuel of prostate cancer just simply is not true.
Really? Okay, so let's hang on, because that is a thing that's relevant to us over 51-year-olds. And I've heard the adverse effects of testosterone actually ends up lowering it, and it's linked to prostate cancer. Yeah, just debunk that.
Yeah, so I believe it was a study done in something like 1928 with 3 subjects, 2 of whom dropped out, and the one ended up with prostate cancer, and that's the study on which this is all based. So it's kind of laughable. Okay.
Oh, wow. That's a big, yeah.
Yeah.
A big control group right there.
I mean, it's terrible. This is the evidence-based medicine we're using, right? So there have been tons and tons of studies. Testosterone for Life is a book that I would highly recommend that your listeners read. This is, I think that's Dr. Now I'm not totally blanking off the top of my head. I can see the book in my car because I carry it with me and I, read through it again when I have time.
What did you say? Testosterone for Life?
Correct. Mm-hmm.
Wow. I don't think we can really forget that title. But yeah.
Yeah, right. Written by a urologist on the East Coast of the U.S. It's interesting because although if your testosterone levels start out very low, like below 250 total, when you give optimal levels of testosterone, your PSA will rise. And so that's where people get a little nervous. However, it will plateau and stabilize even with increasing doses of testosterone. So the risk is low to none. I think he would argue none, although you can't say no risk, right? People are going to get prostate cancer with or without testosterone. They're going to get breast cancer with or without estrogen. The numbers are just there. But testosterone improves quality of life so much. And speaking even longevity-wise, if you do not have optimal testosterone levels, you will not build or maintain muscle. And we know that muscle mass is the number one indicator of longevity, of healthy aging. And so testosterone...
I'm going to say that. Just please say that again.
Yeah, muscle mass is the number one indicator of longevity, of long, healthy life.
So lifting weights, increasing muscle mass is kind of one of the modern day fountains of youth.
It's a non-negotiable. You have to do it.
Well, you have to do it. Right.
Yep.
Functional medicine nurse said, do it. So do it, kids. Big advocate. All right, let's stem cell. We've heard it. We kind of know what it is. Give us the brief overview of what stem cell is.
Right. So they come from ethically sourced amniotic fluid and or the umbilical cord. So these are samples. These are tissues taken from babies who have been, or not from the babies, but from the umbilical cords of babies that have been born. They're home with their parents. They're healthy. They're living. No sort of ethical issues there. They are cells and tissues and exosomes that really, again, promote healing. We used to think that, we're giving these stem cells. The stem cells themselves go into our body and turn into, cartilage tissue. That's actually not how it works. We're learning. Again, this is a way to stimulate the body to promote more, to produce more, to call more stem cells and healing factors to the area, and also decrease inflammation in that area. Decreased inflammation is going to lead to more healing, and also modulate the immune system such that it's in a perfect environment for healing to happen. So there's a lot of kind of different angles that these quote stem cells work on. Preferably now we're calling them MSCs, or medicinal signaling cells, because they work to powerfully signal healing to happen in that area.
It sounds like most of these therapies, if you like, are doing exactly the same. They're calling the little white soldiers to the front line.
Right. And it's kind of a matter of how expensive is each therapy, how effective is each therapy. There's a gradient there. Okay.
So we've got two more, ozone and peptide therapy.
Yeah. So we're going to hear a lot of the same, underlying kind of root functions of these. So ozone, again, creates a bit of an oxidative stress. Now, we are used to oxidative stress being a bad thing. But when our body's exposed to that oxidative stress, it responds by producing more antioxidants. So at a cellular level, we're helping all the cells to function better. When our cells function better, they do what they're supposed to do. They heal. They turn on and off inflammation. They signal the body to do the right thing. So being very general and vague here. But it's such a foundational cellular improver, cellular function improver, that it works so broadly. And then peptides, also signaling molecules. So peptides are shorter chains of amino acids, whereas proteins are longer chains. So I believe it's a peptide if it's less than, I think, 40. There's some fungibility there on who says how many, but it's generally less than 40. And they function as signaling molecules. Insulin, for example, is a peptide. Semaglutide, Ozempic, is a peptide. Glutathione is a tripeptide made of 3 amino acids. So we make these in our bodies. BPC 157, which is probably one of the more commonly known peptides, we actually make that in our stomach. And so these peptides are signaling molecules, and depending on what peptide it is, it will signal a different thing. So again, very regenerative. The theme to all of this is let's get the body back to doing what it's supposed to do so it can heal itself and we can go on being healthy. You don't need to be on stem cells for the rest of your life, or peptides or ozone or anything. The goal here is heal the body and set you free. Basically, you're not chained to medical care for the rest of your life.
Love that. And you do the assessment, discovery call, and then you put on the table a membership, which is a completely different way to look at treatment, right? So you have the maintenance, signature, executive membership. I love that. And so after the diagnosis, if you like, if you can even call that, then you kind of, is there a top-up sequence? You know, we need, and everyone's different, of course, and I've heard of other people, you know, jumping the border and going to places like Mexico or Costa Rica and Panama, you know, to get their, I don't know, whether it be quarterly, 6-month or yearly infusions done, you know, IV bags and stem cells and stuff like that. And that's where it's sort of, a friend of mine used to run, the CEO of Regenerative Medical Institute in Costa Rica, Greg Schindler, and who's been on the podcast, who talks about longevity. He's no longer with RMI anymore, but that's definitely one.
I think we talked to the RMI people, actually. Dave and I were on a call with them maybe a year ago or so.
There you go. So yeah, like, talk to me about the membership. You know, like, so it's not a one-trick pony. It's, you know, there's a top-up process, I dare say.
So typically what I do is at the initial visit, we kind of decide on what labs are necessary to run, and then follow up when those labs are back and go, okay, well, what's the full picture here? What is as full a picture as we can see right now? And so what level of support are you going to need? This is going to be a partnership, right? I am part of the partnership. The patient is part of the partnership. And we both have to do our parts in order for the patient to get results, right? To get better. And so the membership model it enables me to give really good care. There's that partnership, there's commitment to one another. There is, you know, a number of visits, a number of IVs included in there. In our executive membership, we include a lot of the testing. We include an Aura ring. We include Brain Tap, which is a really neat device meant to kind of stimulate parasympathetic nervous system, calm down, kind of a meditative, like a guided meditation with LEDs and red lights and binaural beats. Really sophisticated. So you're bringing in
those metrics, the constant feedback through the Aura rings, and yeah, that's
Correct.
Cool. We talk about device, you know, like apps, devices, etc., wearables.
Well, and data is great, right? The executive membership, we also do continuous glucose monitors that are included. Of course, in other memberships, we can order them. I always love to have more data if it's not going to overwhelm the patient. You have to know your patient. Some people are overwhelmed by too much data. So again, that's where this partnership comes in. But with the memberships, we offer certain discounts on additional services. Say if somebody needed stem cells, I want to have patients have good access to those things, because if that's truly what I think is going to make an impact in their health, I want to be able to recommend that, and for it to be affordable as well.
Very cool. What sort of, you know, I mean, there's no guarantees. That, you know, what would you say to someone if they say, you know, what's my return on investment? What does that actually look like? How do you quantify that?
Ooh, that's so hard to quantify. There can't be guarantees. What I usually tell patients, if somebody does give you a guarantee, you might want to consider running the other way, because this is so individualized. And like, what am I going to guarantee? That you're going to live till 90? Like, you know, what I can guarantee, and this is how I put it to patients, what I can guarantee is that I'm here to work with you. I'm here to support you. I'm here to answer your questions. I'm here to dig for you, especially when patients come with a problem that nobody else has been able to figure out. They, if they had that experience, and so they do want to know, well, can you help me? And so usually my answer is, I'm going to try. And the benefit of working with me or somebody like me is that I can spend the time with you. I can ask the questions and I know how to dig and where to dig. So it's more likely, I suppose, that I will find the answer and help you through it. But a big part of the care and of the relationship is that patient feeling like somebody's on their side, in their corner with them, supporting them and educating them and caring for them, which again is not common, unfortunately, in the traditional medical system.
So let's say, a yearly membership, I mean, we'll dig into it on your website and through Discovery Call and that sort of thing. It sounds expensive. Is that like an ongoing, like if I'm going to get someone on your, like yourself on my team, this might be a reason why a lot of people jump the border and go south and get treatments. I don't know. But is it, no specific prices, but it sounds expensive to have something like that ongoing. What would you say to that?
Well, there's a couple of things. I think that our frame of reference for insurance, first of all, in the U.S., right, we pay for our insurance. We pay almost $3,000 a month for our medical insurance, and it covers very little still. I grew up in Ontario in Canada, and so we grew up with socialized medicine, which you don't pay for, but then also, has its disadvantages too in terms of quality of care and access to care and timing of that care. And so in the U.S. anyways, the culture is very, the culture around healthcare tends to be very individualistic, and I'm not responsible, right? Like my doctor has to fix me. And also I deserve this, right? Like a very entitled view of healthcare.
It's very much built into workplace agreements too, employment agreements.
Correct. I mean, it's a huge part of a compensation package oftentimes, right? Or a factor. The other piece is considering the alternative, right? If you don't take care of your body and learn how to take care of your body, yes, you're spending money on that now, but what does it cost you later? What does a knee replacement cost? Not only, and maybe, in the socialized medicine systems, it maybe doesn't cost you anything financially, but what is it costing you pain-wise, comfort-wise, health-wise in the future, time off work? There's a lot of other factors rather than just money, right, that we can think about. But it is a shift of kind of how we frame and how we think about healthcare. It's changing. We're operating a business serving people who know the value of this.
I think you did a really good job at reframing, not spending, but investing in prevention, right? Investing in prevention rather than spending on the cure.
Correct. If you don't have your health, you can't enjoy your life. You can't go do your bucket list items, right?
Yeah. I mean, that was the whole thing. And look, I love that public perception changing. I love the fact that this is and the reason why I wanted to, get you on, Joya, was to just look at what we've taken for granted for so long. Look at it in a completely different way. Yeah, we're talking prevention. We're not talking cure. Yes, we are talking cure, but we're looking at, these holistic factors first, looking at all these alternative functional therapies, if you like, different ways of doing it. Our eyes are way more open. Thank you, COVID. So if you haven't given us anything, you've made us become more conscious of our choices and not taking everything for granted. And, the purpose of doing podcasts like this is just to help people become more conscious, more aware, and so they can make more informed and educated choices. So thanks so much for, contributing to that library today and opening our eyes more to, what we've taken for granted thus far.
Yeah, absolutely. I love talking about this. I'm super thankful that you were willing to have me on and kind of spread the word about this even further and wider. So yeah, this has been just a pleasure to talk with you today.
I'm looking forward to the house call, 17 hours away, but look, we'll talk about that in the contract. Not contract, but contact. How can people contact you and, get around you? Whether, you're from Australia. I mean, our system is different. America can, there's listeners and watchers all around the world. How can people connect with you?
Yeah, so our website is nourishhousecalls.com, and that's our info on Instagram, Nourish House Calls. Facebook is Nourish House Calls. My email, feel free to email me, is joya@nourishhousecalls.com. I'm licensed at this point in Illinois, Florida, New Hampshire, Vermont, Texas, and Oregon. Several more to come, including California and Washington, Pennsylvania. So at this point, I'm licensed to see patients in those states, whether it's virtually, via Zoom, or in person. I'm based in Illinois, but those are kind of my service areas at this point.
Right. That's a whole other question, Q&A. You can dig into one-on-one, guys, but going to your website even is very informative, and you've put a lot of information on there. So backing up what you've said on this podcast, there's a lot of information, and engaging with you, I think, will be a smart move. Anyone who wants to take their health seriously and whose eyes are obviously open, definitely get in contact with Joya. Joya, once again, thanks so much for being on the Bucket List Life podcast. And have a good night and a healthy night. And I know I have certainly learnt a heap, and so we can all live our bucket list life sooner rather than later. Thanks heaps.
Love it.
Thanks so much for listening to the Bucket List Life podcast with the world's #1 bucket list expert, Trav Bell. For more great content, go to www.thebucketlistguy.com. We'll see you next time.